Hi, I'm Kara. I'm a certified wound nurse, and I'm here with Dr. Phipps, who's a board-qualified podiatrist, and we're here today to discuss how to properly take care of diabetic feet. Over 23 million people in the United States have been diagnosed with diabetes, and about half of those people also suffer from peripheral neuropathy, which is nerve damage that can result in reduced sensation to the hands and feet. Research shows that 15% of people with diabetes will have a diabetic foot ulcer at some point in time, and then even more people will also suffer a traumatic wound to their foot. Both of these people will have a hard time healing because of the diabetes. It also shows even further that up to 80% of diabetes-related amputations are because of an untreated diabetic foot ulcer. So today we're here to show you some quick, simple steps on how to take care of your diabetic foot.
Hi, I'm Cameron Phipps. I'm a board-qualified podiatrist. I'm here with Kara to help assist with diabetic foot care, which is extremely important, as we all know. I have the opportunity in my profession to see a lot of diabetics in the clinic as well as other wound care settings and in the emergency room and hospital. A couple of things as far as regular diabetic foot care. The number one thing is proper hygiene. So, as we all know, you want to wash with soap and water at least once a day. The next thing is making sure to dry completely, especially in between the toes, where a lot of moisture collects. Afterwards, one of the many side effects of diabetes is dry skin. So you want to make sure to moisturize your feet. However, you want to avoid in between the toes because, again, that's where a lot of moisture collects. The biggest thing is with patients that have diabetes, try and avoid soaking your feet. Another option to help keep the feet dry, especially interdigitally, is using powder such as talcum powder or regular baby powder on a regular basis. As far as nail care, you want to make sure to cut the nails straight across and file them straight across. You want to avoid digging out the corners. Also, it is recommended you have a podiatrist or other licensed professional trim your toenails on a regular basis because, again, due to neuropathy, you cannot feel if you are cut or any other options like that. Another option of daily foot care is daily foot exams. It's important if you have diabetes to make sure to check your feet daily. A good time to do it is right before you get in the shower. So you can either sit cross-legged and check your feet manually with your hands or looking at it, or another option is to use a mirror on the floor where you can actually stick the mirror down, put your foot right up against it, and look at the bottom of your feet. Again, you want to check for any foreign objects in your foot. You want to check for any cuts, bruises, any calluses, and any sores that you may have down there. I see it before. We've had a patient in the wound clinic who actually had the top of his prescription cap in his shoe and didn't even know it until he developed a wound there. So another idea is to get professional care. So as a podiatrist, I see most of my diabetic patients at minimum 6 months to a year. However, for nail care, I see them every 90 days. It's a good idea to have a podiatrist or a licensed professional, again, trim the toenails to avoid any injury that you may have. Lastly is proper footwear. You want to make sure to wear, obviously, the proper size shoes. Also shoes that are wide and deep to prevent any rubbing or to prevent any sores that may develop. It's also an important aspect to wear comfortable shoes with inserts that match your feet. Sometimes those be custom inserts with custom shoes. Also wearing appropriate socks that wick moisture away to prevent any rubbing or blisters in your feet. Lastly, one of the most important things you can have, or I could tell you, is to never ever go barefoot. You always want to have some type of a shoe on, even around the house. Very often that's when foreign objects can become lodged in your foot or you develop blisters or other things.
Working in a wound clinic, I see diabetic foot ulcers on a daily basis, and I see firsthand the toll that it takes on a person's health and well-being, not just the patient, but their family and loved ones as well. By taking a few minutes every day to check your feet and routinely maintain proper foot hygiene, you can drastically reduce your risk of developing a diabetic foot ulcer. Be sure to report to a podiatrist or other medical professional with any concerns or further questions on proper diabetic foot care. Thanks for watching, and keep your feet happy!